All right, good morning. I'm Montgomery County Councilmember George Leventhal, Chairman of the County Council's Health and Human Services Committee. Several months ago, I heard, really for the first time, I'd never heard much about these substances before. I was approached by Susie Sinclair Smith, the Executive Director of our Montgomery County Coalition for the Homeless, and she said that she was having a significant problem with clients at the Goody Men's Shelter who were legally accessing synthetic marijuana. I didn't know what synthetic marijuana was, but Susie told me that her clients, after ingesting these substances, smoking them, became unruly, aggressive, hard to manage, and were a threat to themselves and to the safety of other clients. So I held a meeting back in June to learn more about these and found out that indeed at convenience stores throughout Montgomery County, gas stations, beer and wine stores, tobacco shops, packets of treated herbal material had been legally available for sale, and that the effects of smoking these substances are really severe, very unsafe. The dosages are unclear, the chemical compounds are not well known, they have adverse behavioral effects and adverse health effects. But fortunately, by the time we had the meeting in June, the Maryland General Assembly had already acted. And so we're here today to send the word to retailers and to the public that thanks to the leadership of the Maryland General Assembly, these synthetic drugs, which once were sold legally, are no longer legal beginning tomorrow, October 1st, 2013. And so I'm joined by our state's attorney, who will speak first, and by several other officials who will describe the dangers of these substances, but most importantly to communicate that if anyone thought that these substances were legal beginning tomorrow throughout Maryland and here in Montgomery County, they are not legal. The penalties for their sale or their use are substantial. It's a very, very bad idea to use these drugs. They are harmful. We strongly discourage their use, but even more than that, we will be prosecuting those who sell or use them. And so I'm now going to introduce our very effective top prosecutor, Montgomery County State's Attorney, John McCarthy.
Thank you. Good morning, my name is John McCarthy and I'm the State's Attorney for Montgomery County, Maryland. Earlier this year, the Maryland General Assembly passed legislation to address the serious problem of an emerging class of drugs known as synthetic cannabinoids. The law, as George has already pointed out, goes into effect tomorrow, October the 1st. The new law prohibits the sale and possession of these synthetics, which are marketed under such names as K-Spice, Spice, Mr. Nice, Mystery, and many others. These drugs are sold in convenience stores, liquor stores, and gas stations throughout this county. They are packaged in such a way as to make them appealing to young people, often depicting, for example, cartoon characters as a matter of packaging the product for sale. On the street, these drugs are often referred to as synthetic marijuana. That is a misnomer, and in reality, these drugs, which escape normal drug testing screens, are far more potent and even potentially lethal. The distribution of this drug becomes a crime tomorrow. But perhaps more importantly for us today, they pose a health hazard to all of our children. These designer drugs are 5 to 45 times more potent than marijuana. This is modern day glue sniffing. It is today's huffing. We are here today to call upon responsible business owners in our community to remove these substances from their stores and halt the sales of these products immediately. Future sale would be illegal, but more importantly, all of us have a role in ensuring the health and well-being of our children. I want to thank George Leventhal, Delegate Craig Zucker, and other state and local officials who are at the forefront of this issue. Today's press conference is primarily, it's about public education, getting the word out that will protect our children and encourage the good and responsible business owners in this county to comply with the law and remove these substances from their shelves. Thank you very much.
Thank you, John. So to continue amplifying this message, that if you are a retailer who may have thought these substances were legal to sell in the past, you will now be prosecuted and you will be caught. We have Captain Nancy Demme, who is the director of the Montgomery County Police Department's Special Investigations Division.
Thank you. Good morning. This piece of law will help us to do enforcement action whereby before we were unable to take such action because of the changes in the chemical components. Now it targets the effect that the drug has. It makes it much easier for us to take enforcement action. And we don't want the store owners who are perhaps not knowing what they're selling to be, harshly treated by this law immediately. We want to give them notice, educate them, and have them understand that what they are selling is illegal and have them remove it. And we look forward to working with the state's attorney on any prosecutions that are coming.
Thank you, Captain Demme. I want to acknowledge that your deputy, the deputy director of the Special Investigations Division, Lieutenant Ronald Smith, and our hardworking sheriff, Darren Popkin, are also here. We have a unified law enforcement team trying to get this message out to make sure that retailers and the public know that these dangerous products are no longer legal for sale or possession in Maryland beginning tomorrow, Tuesday, October 1st. We have several legislators who were invited who were responsible for the passage of this law. This is, of course, a statewide law. The lead sponsor, Senator Dolores Kelly from Baltimore, was not able to join us, but we have, I don't know if our other state legislators have arrived, we have Delegate Craig Zucker from the Maryland House of Delegates, who's done quite a bit of work on this issue and assisted me in putting today's event together and making sure that we were able to communicate this important message to the public. Delegate Craig Zucker.
Thank you, Councilmember Leventhal, and I appreciate the hard work of my colleagues like Delegate Sheila Hixson and Senator Jamie Raskin. I've had the privilege of knowing the Eichler family, Tony, Sandy, and Stephen, and Charlie, for what was 13 years. And August 2nd will always be seared into my mind when I attended Charlie's memorial service. And when I arrived, Sandy brought me up to the casket where Charlie was laying peacefully and asked that I work with my colleagues both in the county and the state to make sure that tragedies don't happen like this again, and to let the word go forth to businesses that they shouldn't be selling this. And to the Eichler family, I'm proud to say that we're here today to start fulfilling that promise. This is not a journey you have to go with alone. We're here to stand by you. Thank you.
Delegate Zucker mentioned that we have a family here with us this morning, both of whose sons were users of these synthetic cannabinoids. Sadly, Charlie Eichler is no longer here, and his parents, Tony and Sandy Eichler, and his brother Stephen Eichler, are going to join us now at the microphone and tell the story about how these synthetic cannabinoids affected their family.
Thank you. Awareness is something that can mean life or death for a family member or friend, and really have to know what your kids are doing. You have to stay involved in their lives. I was unaware of what my son Charlie was doing, but I saw a change in him, and I asked many questions, but didn't get the right answers, unfortunately. To put a face with what this substance does, there's pictures of my son in front of the podium here. He went from a vibrant young man who was struggling with an addiction problem to a person that was struggling to stay alive. He couldn't walk. He had to wear an adult diaper. He couldn't eat, and he couldn't sleep, and he gave up hope. And a store told him that this was a natural substance that would help him. Well, it's anything but. So to give you some idea, it's a tragedy to see someone like Charlie go through something like that and leave us here to talk about it. But at the same time, we want to do something in his honor. His legacy will be not only to promote this new law, but to also make people aware. Thank you.
I would like to start going around and getting the message out there that not only regular drugs, but these synthetic drugs, even though they will be illegal starting tomorrow, will still be used by teens, adults, and we need to just let them know, because the first couple uses may not have an effect on you, but the course of like 5 or 6 uses, it doesn't even matter, will really impact the rest of your life. Lethal drugs need to be not only outlawed, but starting tomorrow, but not used.
One of Charlie's last wishes was that he wanted to save at least one life. He said, Mom, if I can get one person to stop using K2, then I know I've done my job. This law will definitely save lives. Thank you.
I really want to thank Tony and Sandy and Stephen for making themselves available, and I know that they are also available for one-on-one discussion as soon as this press conference is over. I want to call my very good friend, the Council Vice President Craig Rice, who serves with me on our Health Committee and has been a tremendous advocate for law enforcement and for safe and healthy habits for our youth. Council Vice President Craig Rice.
Thank you very much, George, and thank you so much for your leadership. Today is a shining example of what happens when state and local governments work together to address problems to make sure that our community is safer. And I have to give kudos to Councilmember Leventhal, to Delegate Zucker, and all that were involved in this, because what we are doing today, you've heard about some of the other laws that are going to effect on October 1st. But this is one of the ones that you don't hear about that much. You heard about driving and texting. Well, imagine putting a substance into your body and you have no idea what it is. That's what's happening today. You don't know what the reaction will be with the other medications that you might be taking. This is extremely dangerous. So this is an impassioned plea to all of our retailers and to our community. Stay away from these drugs. They can kill you. They can create an adverse effect that can make life-altering changes so that you will not be the same person again. You've heard from the Eichler family who's lost a loved one. We don't want to continue to have this happen here in Montgomery County, throughout this region, and so that's why we are having this press conference today. Again, I thank Councilmember Leventhal and Delegate Zucker and all the folks that are here today to make sure that that message is heard loud and clear, that we will not tolerate these kinds of substances in our community. So thank you.
Thank you, Craig. I'm delighted that one of the most powerful members of the Maryland General Assembly has now joined us. We thank the General Assembly for moving ahead, for broadening the definition of these drugs so that all of them, whereas in the past the manufacturers could somewhat alter the chemical composition and continue to keep them on the market, the new law substantially broadens the definition so that all of these substances that have this effect, cannabinoid effect on the brain, are now banned. And the chair of the Maryland House Ways and Means Committee, our delegate from Silver Spring, Sheila Hixson, has just joined us.
Well, I'm very honored to be here today with this group and the subject matter, and to the parents who are my love. And I know how much pain they've gone through. That's just one case. They were brave enough to come forward with all the troubles and everything that they had and the emotional toil. They're the ones who are leading this fight, and we're very proud to back them up. And from the state level, as we said, the last piece that we just passed, that is going into effect. It did go into effect as of July 1st, but we're looking at other things along with Craig, that we're looking at taxing any kind of drug paraphernalia, anything. We're sending a message to the business community to say that you can't put out semi-offerings to these people and think and have it sold as not a drug affiliation. And it is, and we hope we could get it off the market. We don't know how close we're going to come to that, but we're going to try. Thank you very much, and thanks for being here.
Great. Thank you for your leadership, Delegate Hixson. So, again, acknowledging some of the folks who are here, we have Robert Hill, who works for our state's attorney, who has been really doing most of the groundwork on this, and I understand that he'll be available, or Mr. McCarthy may be available, to discuss the notification that the state's attorney and the police will jointly be giving to retailers to make sure that they're aware that these substances are now illegal beginning tomorrow, Tuesday, October 1st. And so, and I want to acknowledge that Carol Walsh is here. Carol is Executive Director of our Collaboration Council for Children, Youth, and Families, which works very hard to divert young people from the juvenile justice system and bring multiple resources from multiple agencies to bear to help young people stay on a productive course and not to engage in counterproductive activities like using these synthetic drugs. But our last speaker, I think our last speaker, is Susie Sinclair Smith. Susie brought this issue to my attention. The synthetic drugs have been a real problem at the Goody Men's Shelter in Rockville, where some of the neediest members of our community come in from outside, and you know, it's a difficult environment to run a men's shelter. You're trying to help clients, but at the same time you're trying to make sure that clients are not posing problems for other clients, and this synthetic marijuana was a real obstacle to accomplishing that goal. So Susie Sinclair Smith, please join us.
Thank you, Councilmember Leventhal. I just want to applaud all the players around the podium today for making this bold step to have K2 synthetic substances established as truly being illegal in the state and in Montgomery County. We at Montgomery County Coalition for the Homeless have seen the ravages of this drug on the human body, and it's disturbing. My heart goes out for the Albert family who has lost a loved one. It's truly a vicious drug and one that should not exist or be available. Montgomery County Coalition for the Homeless, we serve about 1,600 men, women, and children who are formerly homeless or homeless in Montgomery County. We focus on permanent housing solutions, but we also run the main men's emergency shelter on Goody Drive and a program called Safe Havens, which connects with individuals who have severe and persistent mental illness. We connect them with psychiatric services. 75% of those individuals who leave our program move on to more permanent housing. We have many vulnerable clients, and for our vulnerable clients, this drug has offered a respite for them to stop the voices in their mind. That's what they have reported to us, that it's able to calm their mind, it's able to give them some peace. But we've experienced the other side of that, which is when the fire rescue squad comes, the emergency medical technicians come, and our clients are in convulsions, they're vomiting, they're not able to articulate anything. Afterwards, they realize that they've gone through a terrible experience, but the main thing that they can say is it stops the voices in their mind. So we do not want this to be, we are very focused on connecting our clients to mental health services, moving our clients into permanent housing, and we view this as a true, an evil in our county that needs to be eradicated. We also, when the fire rescue squad, the police came to our shelter because they come frequently because of the vulnerability of our clients. We talked to them about why does this drug exist? What can we do to keep it from entering the lives of our clients? And there was an expression of uncertainty of was this illegal or was this not illegal? I personally went out and went up and down Goody Drive and found the substance in many of our convenience stores, gas stations, has Scooby-Doo on it, has King Kong on it. One of my staff members tried to contact Disney, Hanna-Barbera, to let them know that their materials were being used in this way. Unfortunately not to great luck, but it is marketed for youth. We are seeing an increasing number of youth at our men's emergency shelter between ages 18 and 24. So we are fully supportive of this drug being not available in Montgomery County. So this state law means a lot for our clients today. I know it means a lot for our county officials here today and for a family who tragically lost their son as a result of this drug.
Great. Okay, well that's it. What we're going to do now is everyone who's available here will be available for one-on-one discussion with reporters if you have any further questions. I know it's a busy news day with so many state laws taking effect tomorrow, and I know there's another press conference to talk about highway safety at 11:30. But we're officially breaking this up, but all of us will stick around and be available for any questions or headshots or interviews that you'd like to conduct. Thank you all very much for coming, and we appreciate your assisting us to get this important safety message out.